We are starting another new. ARF is acute rheumatic fever, not acute renal failure, right? So we are calling AK as acute renal failure is changed to AKI, and ARF is now we are using for acute rheumatic fever. You all know it's a multi-system disease. It can involve many tissues in the body, and the usual age that ARF occurs is between 5 and 15 years. And the incidence is 1 in 10,000 population. So compared to olden days, the rheumatic fever has come down drastically. It used to be predominantly a disease of the developing countries in the past because of the improved sanitation and hygienic conditions. Even in the developing countries like our country, the rheumatic fever, rheumatic heart disease have come down very significantly. So what is the rheumatic fever actually? Acute rheumatic fever. It's an infection. It's a bacterial infection. Group A, streptococcal infection. And it is an immune-mediated disease. First, let us talk about acute rheumatic fever. As I said, it occurs in 5 to 15 years age group of people, male and female. It starts with fever, anorexia, lethargy, joint pains, rash, and following a sore throat 10 or 15 days back. First, it will begin with sore throat. Subsequently, the sore throat, after a week or two, it will be followed by the joint pains, rash, and typical of acute rheumatic fever. 75% of the patients will have arthritis, and only 75% will have arthritis. So fever, anorexia, lethargy, joint pains, rash, sometimes carditis, sometimes chorea. These are the symptoms of acute rheumatic fever. What is it? It is a bacterial infection, bacterial upper respiratory tract infection caused by group A streptococcus. So that is the bacterial infection. Just like any infection. And this bacterial antigen, when it enters into the body, it develops antibodies in the body. Body develops antibodies, and there's an antigen-antibody reaction, which is responsible for all these signs and symptoms in the joints and skin and heart, etc. This is an antigen-antibody reaction. These antibodies stimulate the inflammatory process. That's why we have other symptoms of joint pains and other things. So even acute rheumatic fever also, even acute condition also, it will, as I told you, it is a multi-system disease. It will affect the some special liking towards certain tissues like joints, skin, and heart. In the heart, it can affect all the three: endocardium, myocardium, and epicardium. All the three layers of heart can get involved with acute rheumatic fever. So what is the pathology? The moment the bacteria enters into the throat, it will cause fever, body pains, and lethargy. Then after 2 to 3 weeks, the post effect of the streptococcal infection will cause all these skin, joint, and heart related signs and symptoms. So that is the sequelae of acute rheumatic fever. So what happens in the pathology? Pathology, the antigen-antibody reaction results in fibrin degeneration of the tissue. The fibrin degeneration, extra fibrin gets deposited in this said tissues of joint and heart, etc. And you also can see Aschoff nodules with a lot of giant cells and macrophages and T lymphocytes getting together, forming Aschoff nodules. So how do you diagnose acute rheumatic fever? How do you diagnose? You all know the Jones criteria. We have revised Jones criteria. According to that criteria, I think I have the criteria and I'll show you. So either two major criteria or one major and two minor criteria is enough to diagnose acute rheumatic fever. Do you have it? Yes. Can you show? Yes. The Jones criteria. Yes. All of you should know about Jones criteria. You may get a question in your theory, or when you are getting a case in practicals also, the examiner might ask you what is Jones criteria. So this is the Jones criteria. Coming there. Jones criteria, you know. No, this is not the one. Okay. Yeah. Yes. Yeah, this is Jones criteria. The major criteria are carditis, polyarthritis, chorea, erythema, marginatum, and subcutaneous nodule. These five are major criteria, and minor ones are fever, arthralgia, previous rheumatic fever, raised ESR or CRP, leukocytosis, first degree AV block. So these are the minor criteria. So either two major or one major, two minor criteria are enough to be called as a rheumatic fever. So that is the Jones criteria you should know. Okay. And other tests, what are the other tests? If you do culture of the throat culture, throat swab culture, only 25 to 30% of the time you can get gram positive group A streptococcal infection. So it only 25 to 30% of the times it will come as a positive thing. And another very important test is ASO, antistreptolysin O titer, also is positive in many patients. So the diagnosis is clinically, patient have fever, sore throat, followed by the joint pains. And the typicality of the joint pains is, what is the typicality of the joint pains? Can someone type the answer? What type of joint pains this acute rheumatic fever patients will have? Migratory polyarthritis or fleeting type. Yes, you're right. Migratory or fleeting type means one joint gets involved, then another joint. Usually the large joints are involved. Knee joint, and ankle joint, and wrist joint, and elbow joint. The larger joints are involved. That is called fleeting. Fleeting is jumping. It jumps from one joint to other joints. So that's why they say acute rheumatic fever, it licks the joints and bites the heart. Licks the joints and bites the heart. So it doesn't cause any major damage to the joints, though it is causing arthritis, but it causes major damage to the heart. That's why they say acute rheumatic fever licks the joint and bites the heart. So in this fleeting, what do you mean by this fleeting type or migratory type of polyarthritis? Which means that a pain develops in one joint, and after 2 or 3 days, the pain, another joint gets involved. But the first joint did not get all right. I mean, the students usually make a simple common mistake every time, that one after the other. No, one joint pain subsides and then next joint gets involved. It's not like that. When first joint is still having pain, the second joint gets involved. Then first and second joint pain still having, then third and fourth joints can get involved. It's a fleeting type of migratory polyarthritis. That is a typical of the acute rheumatic fever.